Most of us take a wait-and-see approach to heart disease. If we're diagnosed, we tell ourselves we'll deal with it. But cardiovascular disease takes years to develop. And a new study by the American Heart Association found many U.S. kids may be at risk of heart disease later in life. The Fox Medical Team's Beth Galvin is here to talk about this.
This study looked at several issues: the way children eat, their weight, how much exercise they're getting, and what these researchers found is a bit of a wake-up call.
The habits kids form early on in childhood may shape who they become and what they do as adults. Yet a recent study by the American Heart Association shows many U.S. children are coming up short when it comes to taking care of their hearts. A big challenge, getting enough exercise. The Heart Association recommends 60 minutes of moderate to vigorous physical activity a day for kids. But only half of school-age kids and less than 10% of older teens are getting that much exercise. And it may be undermining their hearts as they grow up.
We often don't think about heart health until something bad happens.
And pediatric cardiologist Dr. Dennis Kim of Children's Healthcare of Atlanta says when we do think about things like heart attacks and stroke,
we think about other adults that we know, other family members we know, other relatives. We don't think about our kids.
But many kids may already be at risk. The CDC says more than a third of U.S. children are now considered either overweight or obese. And many already have at least one risk factor for heart disease, like high cholesterol, high blood pressure, or prediabetes. A major problem is the way children eat.
I think that as a parent, there are many challenges.
The Heart Association says 91% of kids don't eat a healthy diet in this country, and most of what they do eat comes from high-calorie, low-nutrition foods and simple carbohydrates, like sugary drinks and desserts. But Dr. Kim says you can teach your child to make healthier choices by serving primarily heart-healthy foods in your home, like fruits and vegetables and whole grains and fish.
Really to have them understand what a healthy diet is, to prioritize that as individuals and as families.
Dr. Kim encourages parents to work with their kids and give them a plan or a roadmap to take care of their hearts as they grow up. And he says you need to be a good role model. So if you want your children to eat a little bit better or get a little bit more active, you need to do it too, Mom and Dad. For the Fox Medical Team, I'm Beth Galvin.